Advancing SADC key populations commitments beyond 2030 is the theme of the ongoing AIDS and Rights Alliance for Southern Africa, ARASA, in collaboration with the SADC PF Roundtable discussion. Attending the meeting are parliamentarians, CSO representatives, and key and vulnerable population activists such as adolescent girls and young women, people who use drugs, sex workers, persons with disabilities, and the LGBTI community in the SADC region. We are now joined by Ntombi Muchuchuti, who is attending the roundtable discussions in Johannesburg, South Africa, with some talking points. Over to you, Ntombi.
Thank you very much. Ntombi Muchuchuti believes that Africa's solutions are in Africa, and she is the director for the AIDS and Rights Alliance for Southern and Eastern Africa. Good afternoon, Doctor. Thank you so much for taking time out of this very interesting meeting to talk to us. I see you have got a very diverse stakeholder representative around that table. Talk to us about this and why have you seen a deem to have them around one table?
Indeed, ARASA does work with diverse stakeholders, and in the room we've got parliamentarians, we've got the human rights commissioners, we've got civil society, we've got the development practitioners and development partners, as well as the communities. For us, what is important is to convene the space to people to engage and to talk to each other. I think, like you rightfully understand, that the theme this year is to let the communities lead. So as ARASA, we try by so much means not to speak for or on behalf of any group to the other. We work with parliamentarians, we train them, and we engage with them in relation to the issues that affect mainly the key population in their diversity. We also work with the human rights commissioners at national level. Our intention is to ensure that the human rights commissioners are the stewards of the legal frameworks in countries. And we see a lot of criminalization of the key populations. So we thought if they are in the same room debating and discussing, so that we remind ourselves on our commitments as a country, as SADC, what did we agree and attest to that we can't do? And also we need the civil society to speak, because sometimes there's shrinking space of civil society. And because of the laws and the volatile space, they are not able to speak openly.
I was extremely not believing that this meeting will go the way it is going. Now, according to the new HIV infections by the UNAIDS, it says these statistics of HIV since 1995 has reduced with 59%. But from this statistics, women and girls account for 46%. What do you make of this stats?
I think as countries, as stakeholders like we are, we could and we should do better. Happening, but I think we intentionally have to deliberately commit ourselves to doing better than what we have done. There are various areas that have got gaps. For instance, the knowledge management. There are various frameworks, from the global frameworks, the regional frameworks, country frameworks, but sometimes they are so abstract and detached from country contexts. So as entities and stakeholders, we have to understand that what does it mean at contextual level? What does it mean in terms of reducing the statistics when it involves the KPI? We also look at science. Science is doing so much and progressingly going forward, but we are leaving other entities behind. Is it possible that in terms of manufacturing, in terms of manufacturing the treatment drugs, for instance, the patents and the distribution, there's something that can be done better? The political will and the legal framework, is there anything that we can adjust in countries? Is there any commitment that we have to take seriously that currently probably is lagging behind? We are looking at the health budget in countries. We are looking at the national priorities and also the development cooperation. We get various countries giving aid. We are saying that sometimes we get governments coming in and changing the priorities, not consulting the context. So it's important for us to come together like we are doing and say to ourselves what aspects of our work should come together for us to constituencies having high prevalence. And in that subgroup also there is a population of the LGBTI community, people who use drugs, as well as people that are in prisons, whose statistics are shooting up. Is there anything that we think we can do as states and governments, or is there anything that we should do as development cooperation practitioners?
Okay. Thank you so much, Doctor. It's World AIDS Day tomorrow, and we will bring you more interviews with parliamentarians and, of course, with Dr. Muchuchuti and the rest of the members that are joining this meeting. Thank you so much, Raymond. It's over to you, and we're coming to you live from Johannesburg. I'm Nomhle Kangotri.